What's today's health fact? If you have been diagnosed with hypertension, this video will reveal the causes and who is most at risk. Stay till the end to find out how you can treat hypertension with dietary changes. If you want relevant information on gaining and maintaining quality health, we upload videos about those topics on a weekly basis. Hypertension, also known as high blood pressure, is a silent killer because it often has no noticeable symptoms and can lead to serious health complications if left untreated. Hypertension develops when the force of blood against the walls of the arteries becomes too high. This can be caused by a variety of factors, including obesity, lack of physical activity, smoking, high salt intake, and a family history of hypertension. It can also be a side effect of certain medications, such as birth control pills or decongestants. Symptoms of hypertension include headaches, shortness of breath, and nosebleeds. However, these symptoms may not appear until the blood pressure is very high. This is why hypertension is often referred to as a silent disease. There are several causes of hypertension, also known as high blood pressure. Primary hypertension, this is the most common type of hypertension and has no known cause. It is thought to be the result of a combination of genetic and lifestyle factors, such as obesity, lack of physical activity, and a high salt diet. Secondary hypertension, this type of hypertension is caused by an underlying condition, such as kidney disease, sleep apnea, or a tumor on the adrenal gland. Chronic kidney disease, damage to the kidneys can lead to hypertension as the kidneys play a role in regulating blood pressure. Thyroid disorders, an overactive or underactive thyroid can cause hypertension. Medications, certain medications, such as birth control pills, decongestants, and some antidepressants, can cause hypertension as a side effect. The risk of hypertension increases as you age. Family history, if your parents or grandparents have hypertension, you may have a greater chance of developing it as well. Stress, chronic stress can cause a temporary increase in blood pressure. It's also worth noting that people who have diabetes or prediabetes are more likely to develop hypertension as well. If you've made it this far, go ahead and give this video a thumbs up, subscribe, and tap the bell so you don't miss future health facts. Who is most at risk? There are a few groups of people who may be at a higher risk for hypertension or high blood pressure. The elderly, as we age, the risk of hypertension increases. As we age, the blood vessels lose their elasticity and become stiffer, which makes it harder for the heart to pump blood through them. This can cause an increase in blood pressure. If you're overweight or obese, you have a higher risk of developing hypertension. Carrying extra weight can put extra strain on your heart and blood vessels, which can lead to high blood pressure. Some people may have a family history of hypertension. In that case, you may be more likely to develop it as well. If you're African American, you may be at a higher risk of hypertension. African Americans are more likely to develop hypertension than other ethnic groups. Having diabetes or prediabetes means you may be at a higher risk of hypertension. High blood sugar levels can damage the blood vessels, which can lead to hypertension. If you lead a sedentary lifestyle, it might increase your risk of hypertension. Regular physical activity can help lower blood pressure, so if you're not getting enough exercise, you may be at a higher risk. Chances are if you're a heavy drinker, you may be at a higher risk of hypertension. Drinking too much alcohol can raise blood pressure, so it's best to limit your alcohol consumption. It's also worth noting that people who have high levels of stress can also be at a higher risk of hypertension, as stress can cause a temporary increase in blood pressure. When it comes to dietary changes that can help reduce hypertension, there are a few key things to keep in mind. First, it's important to limit your intake of salt. High salt intake can cause your body to retain water, which can increase blood pressure. Aim to consume less than 2,300 milligrams of sodium a day, and if you have hypertension, your doctor might recommend even less. Second, eating a diet that is rich in fruits and vegetables can help lower blood pressure. These foods are high in potassium, which can help balance out the effects of sodium in your diet. Bananas, sweet potatoes, avocados, and spinach are all great sources of potassium. Third, eating foods that are high in fiber can also be beneficial. Foods such as whole grains, nuts, seeds, and legumes are all good sources of fiber. Eating a diet that is high in fiber can help lower blood pressure, as well as lower cholesterol levels. Fourth, eating more fish, nuts, and seeds can provide omega-3 fatty acids which can help lower blood pressure. Fish such as salmon, sardines, and mackerel are great sources of omega-3 fatty acids. Nuts such as almonds, walnuts, and cashews are also good sources. Fifth, drinking green tea and consuming probiotics, like yogurt, can also help in reducing hypertension. Green tea contains compounds known as catechins, which have been shown to help lower blood pressure. Probiotics, found in fermented foods such as yogurt, can also help lower blood pressure by improving the balance of bacteria in the gut. It's also worth noting that it's important to limit or avoid foods that are high in saturated and trans fats, as they can contribute to high blood pressure and increase the risk of heart disease. It's important to remember that hypertension is a complex condition, and dietary changes alone may not be enough to lower your blood pressure. However, making healthy dietary choices can be an important part of an overall treatment plan, which may include medication and lifestyle changes. Consult your healthcare provider to find the best plan for you. If you'd like to see more videos from Health Facts, click on the suggested video on the lower left of the screen. If you have any input on what health facts you would like us to address in the future, leave them in the comments section below. Stay healthy, and get the facts.